Hello, this is DrNUTRIFITHEALTH.com. Today, we are going to talk about aortic aneurysm. A famous scientist died because of this dreadful condition. Can you guess who? It's none other than Albert Einstein. Let's have a brief introduction about aortic aneurysm. When the diameter of arterial lumen increases by 50% of its normal diameter, then we'll call it as aneurysm. And if this localized abnormal dilatation occurs in the aorta, we will call it as aortic aneurysm. Aorta, the largest vessel of our body, starts from our heart, forms an arch, descends into our thorax, and then reaches to the abdomen through the aortic opening in the diaphragm. Based on its location, aortic aneurysm can be divided into thoracic aortic aneurysm and abdominal aortic aneurysm. If the aortic aneurysm is present in the thoracic aorta, we'll call it as thoracic aortic aneurysm, and if the aortic aneurysm is present in the abdominal aorta, we'll call it as abdominal aortic aneurysm. Now let's talk about the risk factor of aortic aneurysm. Smoking. It is the most common risk factor that can cause an aortic aneurysm. When you smoke, it increases the chance of getting aortic aneurysm by 3 to 5 times. Aortic aneurysm is usually seen among the elderly age group people. It is reported that 5% of the people aged 60 years and above are affected by aortic aneurysm, and it progresses with further increase in age. So, screening test is highly effective in those age groups. 6. Males are more prone to develop aortic aneurysm than females. It might be because of the fact that females are protected with estrogen hormone. Family. If you have a family history of aortic aneurysm, then you are more likely to develop aortic aneurysm in your elderly age. Obesity. Obese persons are more prone to develop aortic aneurysm in their elderly age. Now let's discuss about the causes of aortic aneurysm. Atherosclerosis. It is the most common cause of aortic aneurysm, which simply means hardening of the blood vessel. About 80% of the cases of aortic aneurysm are associated with atherosclerosis. Hypertension and high cholesterol level favors the formation of atherosclerosis, which ultimately leads to the formation of aortic aneurysm. Genetics or genetic cause. Certain genetic conditions like Marfan syndrome, Ehlers-Danlos syndrome, Loeys-Dietz syndrome, and Turner syndrome can also lead to the formation of aortic aneurysm. Vasculitis or inflammation of the vessels. Certain vasculitis diseases like Takayasu arteritis, giant cell arteritis can also lead to the formation of aortic aneurysm. Infections. It is among the rare cause of aortic aneurysm. Untreated cases of syphilis, tuberculosis, streptococcal infections, staphylococcal infections can also lead to the formation of aortic aneurysm. Now let's talk about the symptoms of aortic aneurysm. You remain asymptomatic throughout the course. If symptoms presents, it might be because of the compression of surrounding structures, or the aortic aneurysm is in the verge of rupture. If the thoracic aortic aneurysm compresses the surrounding structures, the patient may present with symptoms like chest pain, coughing, difficulty swallowing, difficulty breathing. Similarly, if the abdominal aortic aneurysm compresses the surrounding structures, then the patient may present with symptoms like central abdominal pain, back pain, flank pain, vomiting, or edema of the lower limbs, which means swelling of the lower limbs. Now, talking about the investigations, if your doctor suspects of aortic aneurysm, then he might ask for certain investigations. In case of thoracic aortic aneurysm, chest X-ray, echocardiography, CT scan, MRI are usually recommended. In case of abdominal aortic aneurysm, ultrasonography is usually preferred in place of chest X-ray. Now, let's talk about the treatment part. Every symptomatic patients with the size of aortic aneurysm greater than 5.5 cm or the cases of ruptured aortic aneurysm needs surgical repair. There are basically two types of surgical repair. One is open surgical repair and the next one is endovascular aneurysm repair. In case of open surgical repair, your surgeon will open the abdomen or the thorax, locates the site of aortic aneurysm, clamp the above and the below portion of the aortic aneurysm, and then the stent graft is placed at the site of aneurysm, and then the clamps are removed. And in case of endovascular aneurysm repair, your surgeon will open both of your femoral arteries. A catheter loaded with stent graft is guided towards the site of aortic aneurysm with the help of radiographs, and a stent graft is deployed at the site of aneurysm. Certain conditions like Marfan syndrome needs medical treatment. It is best treated with beta-adrenergic blockers, which prevents the further progression of aortic aneurysm. Now let's talk about the prevention part. It is mandatory to perform screening tests among the elderly age group people, age above 60 years. Quit smoking and tobacco consumption. Be conscious about your diet and exercise, and keep your blood pressure and cholesterol level under control. Thank you. Thank you for watching the video and your time and patience. If you like the video, please subscribe it and share it. Thank you.